Attention artérielle.
Inside a simulated emergency ward in Nairobi, healthcare workers attend to a mock patient displaying symptoms consistent with Ebola. Sis Ndiaga is among a dozen of them taking part in the exercise. He says the realistic scenarios have improved his readiness to respond to an Ebola outbreak while preventing infection.
I
decided to participate in this training because it already seemed important to me. Every time there is a new epidemic, you find that there is always a lack of preparation. So, at times, we could be very complacent and all that.
Kenya has never recorded a case of Ebola, so participants practice identifying suspected cases, managing isolation wards, and safely handling infectious materials while wearing full protective gear. These skills are critical to limiting the spread of disease.
We are targeting doctors, clinical officers, nurses, and lab people. We are also targeting people working in water, sanitation, and hygiene.
The exercise brings together healthcare workers from different disciplines, helping them prepare for a real outbreak.
We are reinforcing a lot all the prevention, control infection, all the measures for infection control. The one that are systematic in all the medical activities, but the one that are specific for Ebola, how to protect themselves, how to take care of the patient.
The preparations come as a controversial US-funded Ebola isolation facility for American citizens in the country triggered protest over risks to public health, prompting a Kenyan court to suspend its construction. Recent outbreaks of Ebola and other infectious diseases across Africa continues to expose gaps in health systems. They underscore the importance of not just preparedness, but early detection and rapid response. But equally important is community awareness. This is critical in detection and prevention of future outbreaks that could save hundreds of lives. The World Health Organization declared the latest Ebola outbreak in DRC in May. While there is no outbreak in Kenya, government officials say they're taking measures to reduce the risk of cross-border spread.
We heighten our surveillance activities so that now, instead of just randomly picking patients, travelers to be able to check, we now scrutinize everybody who is coming in so that we can be able to pick maybe those who have elevated temperatures and things like that.
est transposé dans la chèvre.
Organizers say at least 1,000 healthcare workers have completed the training. The outbreak may be simulated, but the lessons are real and could be used to respond quickly if Ebola reaches the country. Victoria Amunga, Africa Matters, Nairobi, Kenya.